Hello, this is Dr. E, and we're going to be covering 8.14 about pollution and human health. Learning objective here is to identify sources of human health issues that are linked to pollution. Such just the skills to be able to design an experiment, basically. Come up with a research method, design or measurements used. There's 4 basic essential knowledges that we'll be going through. Cause and effect, synergism, dysentery, mesothelioma, and respiratory problems. Relative exposure and synergism. It's difficult to establish exactly how toxic different pollutants are to humans because we have so many ways of or routes of exposures to so many different pollutants. Therefore, studying the effects of just one pollutant is extremely difficult. So what are some of the routes? Ways that a pollutant enters the human body, for example, lead. Really old water from old water pipes and paint chips can enter the body via the mouth. Mercury can come to our body through seafood such as tuna. Carbon monoxide can come from indoor biomass combustion. Remember, it has to be incomplete combustion. Particulate matter can get to us from pollen, dust, etc. Arsenic is by rice, groundwater. Synergism is the idea that when 2 or more things interact, it can cause a greater effect than each of them individually. I lift 100 pounds, someone else lifts 100 pounds. Together we can lift 300 pounds. For example, with diseases, asthma caused by particulate matters from a power plant, particulate matters from a power plant can make us sick. COVID-19 damaging our lungs can make us sick. Together, they can kill you. Carcinogen effect of asbestos combined with lung damage from smoking. Synergisms make it especially hard to pinpoint the exact effects of one specific pollutant on humans. One of the diseases is dysentery. It's a bacterial infection caused by food or water being contaminated with feces, especially in less developed countries, where sewage released into rivers and streams that are used for drinking water, and therefore you drink sewage. It causes intestinal swelling and can result in blood being lost into the feces. Causes severe dehydration due to severe explosive diarrhea. This causes fluid loss. It can kill up to 1.1 million people worldwide annually, most in less developed countries with poor sanitation and limited access to water purification and filtration. If you have it, it can be treated with antibiotics that kill the bacteria causing the infection, and kills the bacteria causing the infection, and access to treated or filtered water, which then can be used to rehydrate you. Mesothelioma is another problem. It's a type of cancerous tumor caused by exposure to asbestos, primarily affecting the lining of the respiratory tract, lining of the heart, or the lining of the abdominal cavity. So what happens is the asbestos breaks off from old fire-resistant materials that are often used in insulation materials such as attics, ceilings, and floorboards. So it breaks off, you breathe it in, gets into your lungs, and it's such that it doesn't go away. It then triggers a response leading to cancer. When the insulation becomes physically disturbed, asbestos are released into the air and inhaled. To get rid of it, you need to to remove the asbestos-containing insulation. It needs to be done by professionals with professional proper training and equipment that protects them from inhaling the asbestos. The area where the asbestos is removed should be sealed off from other areas of the building. Air should be well ventilated during the removal process. Insulation without asbestos should then be used to replace the old insulation. Tropospheric ozone. Tropospheric ozone worsens respiratory conditions like asthma, emphysema, bronchitis, and chronic obstructive pulmonary disease. Causes burning in the eyes, throat, irritated mucous linings, cause shortness of breath, wheezing, coughing, Asthma, it causes asthma attacks, chest pain when inhaling, increased risk of respiratory diseases, pulmonary infection, increased risk of heart attack, limits overall lung functions, irritates muscles, respiratory tract, irritates eyes. It's from photochemical breakdown of nitrous oxide. In other words, it's photochemical smog, where nitrous oxide combines with volatile organic compounds, leading in the presence of sunlight, leading to ozone. It's only harmful in the troposphere. Stratospheric ozone protects us from UV radiation. Troposphere is where it hurts our eyes and causes problems. Practice 8.14. Below is a map of a river that is used as a main drinking water source for the Chinese village of Huangkang. Chinese scientists suspect that the sewage treatment plant is releasing untreated sewage into the river. Ugh. So, if scientists plan to measure fecal coliform bacteria counts at 6 sampling sites, 1, 2, 3, 4, 5, 6, around the village, the sewage treatment plant, and the direction of the flow of the water, make a claim about which site should serve as the control site for the experiment. Justify your answer with evidence. B. Can you identify a disease that scientists could use throughout the city and surrounding areas that could test for the people of Huangkang? Explain how the prevalence, where it is, would help the researchers determine whether the sewage treatment plant is releasing untreated sewage into the river. Thank you, and I hope this was helpful.